Hi, everybody. I'm Karen Hartglass. You're listening to It's All About Food. Thank you so much for joining me. Very special guest today, Dr. Ronald Weiss. He's an MD, dual board certified in internal medicine and lifestyle medicine. Ron Weiss, MD, is a primary care physician in New Jersey and New York who serves as executive director of Ethos Primary Care and as assistant professor of clinical medicine at Rutgers, New Jersey Medical School. Dr. Weiss is not only a physician, but also a botanist and farmer. And he offers an evidence-based food as medicine approach to healing from chronic illness and optimizing wellness. He has been featured in top media, including the New York Times, the New York Post, the Today Show, New Jersey Monthly, and the feature-length documentary Eating You Alive. There's more to that bio, but I could go on all day. I just want to get right to the live portion. Dr. Weiss, thank you for joining me on It's All About Food.
Thank you for having me, Karen.
I usually get excited when I talk to medical doctors who know how to cook. And that's mostly the plant-based vegan doctors that I talk to, and they're in the kitchen and they're telling us how to make these delicious, healthy meals. But a doctor that knows how to farm, that's a whole new level. And the funny thing is, I just interviewed medical doctor, neuroscientist, and author Gregory Burns. He has a new book coming out called Cow Puppy, and he also has a farm in Georgia. So, like, is this a thing? Doctors wanting to farm in a sustainable way?
I wasn't aware that it is a thing. My specific interest in it goes back to my several points in my life. I would say the first point was when I first became interested in plants, which is when my mother bought me a pack of, not of magic beans, but of magic seeds when I was 4 years old for my birthday. They were called 4 o'clocks. They were an old-fashioned flower that would be planted in Victorian time gardens and would open every day at 4 o'clock.
Oh,
And
what fun.
I was amazed by this, amazed. And they came and come in all kinds of beautiful colors, paisley, splashes of like different colored flowers in the same plant, and trumpet shaped and perfumed, and they opened at night. And it was just amazing to me, and I was entranced from planting those seeds. I was fully into plants, and
Beautiful.
so as I grew older, I wanted to be. I took care of my family's garden, did all the plantings on our property, and I wanted to become a farmer. And but my parents,
and your parents said, no, you have to be a doctor.
My Jewish parents said you have to be a doctor. And so I became a doctor, but I never lost that desire. And while I was a pre-med in college, I majored in botany. I tried to fit plants in wherever I could, in every corner, in every space, in every crack. I always fit plants in. And then what I was not aware of along my medical education was the power of plants. I knew they were great to grow, and I loved growing them and eating them, but I was not aware of their healing powers until my father became diagnosed with an late stage pancreatic cancer.
Oh.
And there was nothing that could be offered to him from the best cancer hospital in the world. And by chance, I happened to stumble across a plant-based diet, which is known as the macrobiotic diet in its day.
Sure.
And we placed him on that, and he had an amazing reversal of the pancreatic cancer for about 1.5 years, which was CAT scan proven. He was on no other treatment. He finally succumbed eventually to the cancer because it was very late stage when we started. But that was my portal of entry into using plants as healing tools. But I went on in life. I kept practicing medicine, and then as I continued to go, I began to realize with our growing environmental difficulties, that farming and food systems were at the core of these problems. Not only was the way we farmed at the core of our chronic disease epidemic, but the way we grew food and our food system was also at the core of environmental catastrophe. So during my midlife crisis, I decided to gather both of these good reasons together to heal the planet and our environment and people, and gathered them together on a farm and to start farming as the basis of a new system. I like to call it a farm-based healthcare system. And so went to look for a farm to buy. And that's how we started.
Do you ever sing the song, Dr. Ronald had a farm, E-I-E-I-O?
Wow, for some reason I've never thought of the connection between Ronald and McDonald.
Right.
Except for when the kids used to torture me with that epithet in kindergarten. But no.
Yeah, I think we should write a new one.
But we on our farm, we don't have ducks, chickens, pigs.
Right.
We have bears, eagles, turtles, frogs, and we have wildlife on the farm.
Right.
Not livestock.
Let's rewrite that song.
Yes. Gladly.
Right. And on his farm, he had some frogs, E-I-E-I-O, with a croak croak here. Okay. To be continued. Love the story. Why aren't more doctors as smart as you are? Connecting those dots. Certainly you didn't learn about farming in your medical training, just in your botany training.
No, and no, I did not learn about farming in my botany training.
Okay.
I learned about the physiology, the pathology of plants, the different kinds of characteristics, the taxonomy of plants, those kinds of things, the way plants work, the way they grow. But farming is a little different.
Yes.
Farming is a very practical application, it's a food production, and so in order to learn about that, I had to find myself mentors, and I went about finding myself teachers to teach me, and so that took about 8 years to do.
Yeah.
I found a number of teachers, and they were fantastic. One of my teachers to this day is our farm manager, who has been here for the last 10 years, Nora Puglisi, who is, in my estimation, the best organic farmer in the state.
Okay, so you're doing organic farming.
Yes.
Is it a certain kind of farming? There's so many different categories out there.
So there are two general categories. There's conventional farming, and then there's
biodynamic. There's veganic. There's veganic.
I'm going to say organic farming.
Okay.
Two general categories.
Yeah.
There's conventional farming, where
which is a crazy name. A crazy name for it, right? It's really industrial.
Yes. Well, because right, and I guess it depends on what scale you do it, right? I guess it is very possible to have usually when we apply the word industrial, it intimates
Large.
enormous scale,
Yeah.
right? This scale is not human. It's industrial. It
Yeah.
is, you know, in my day when I was growing up in New Jersey, um, when New Jersey was still richly the Garden State and was top producers of tomatoes and asparagus and in the nation, blueberries and cranberries and peaches and green peppers and eggplants, all the market basket, almost all of it was being done conventionally.
Mm-hmm.
But I wouldn't say industrially because New Jersey farms historically are very small in size. They're like 50 acres, 100 acres, that's it. But when I say conventionally, I mean that chemicals are being used in the form usually of fertilizers and pesticides in order to bring to market a crop. And um, and then there's the other side of the coin. And I guess I'm going to use the word organic because that's what people are familiar with. But or just even if you're certified organic, it doesn't mean that you're not using chemicals. I just want to make that clear. There
A-
are USDA organic certified approved chemicals. Some of them are pesticides like the pyrethrins that are broad spectrum pesticides. They can kill a lot. There's even an approved fertilizer that can be used. But so in any event, those are the two general areas. I think the area we fall into is we are certified organic by the USDA. However, we go far beyond that because we do not apply, we will not even apply any or OMRI approved or killing chemicals to anything. We will not apply any kinds of chemical fertilizers. And so we are certified by the Real Organic Project, which is probably the highest level organic certifier, higher than the USDA. And hopefully someday, I hope we might be able to, we consider ourselves regenerative. And if you want, ask me what that means.
Sure.
But someday, perhaps even we can get that certification.
Excellent. Good for you. Where do I get your food?
About an hour west of New York City. You'd have to drive here. We have the Doctor's Farm Market, which is open every weekend on Fridays and Saturdays. It's open to the public. And I heard that our vegetables and our fruits and our grains, they're the best from what I've heard. I can't comment personally, but that's what people tell me.
Long time ago, wasn't medicine related to using plants? Long time ago.
Yes. Well, in after my father passed, I I took out my old medical school diploma, and for the first time, when I received the diploma, I had to take the oath of Hippocrates, but I was never taught who this person was. And so as I was unpacking my boxes after I moved out of my parents' house, and I placed this diploma on the wall, there is a golden embossed image of him on my diploma. And I began to think, you know what? Who is this guy? I don't know anything about him. And I went back to the library and started to read. And it was his foundational idea that food is medicine and that it is the most powerful medicine. And so from that period on, I basically decided to practice using those ideas primarily.
Okay, how did you find lifestyle medicine?
So just in case any of your listeners don't know what this is, lifestyle medicine, I like to tell people, is it's the latest kind of doctor that you can find. We're the new kids on the block. Like everyone knows what a dermatologist is. You've been to a gynecologist. If you broke your wrist or ankle, you were to an orthopedist. When you were a kid, you went to your pediatrician. But nowadays, you can go to a lifestyle medicine specialist. And what this is it's a kind of doctor that chooses primarily to prevent and to reverse health problems and chronic illnesses using a person's own behaviors,
Ooh.
lifestyle behaviors. And there are 6 areas or zones within which these behaviors fall. Number 1 is eating. And the thing we know is that eating whole plant foods is the kind of eating that is very helpful and powerful to preventing and reversing disease. And number 2, and when I'm giving these numbers, they're not in any specific order, but number 2 is movement and exercise. Number 3 is the realm of sleep. Number 4 is stress management. Number 5 is connection socially to other human beings. Number 6 is staying away from harmful substances, whether it be cigarette smoking, drugs, alcohol, or even asbestos or radon in your basement. And here on the farm, we've added a 7th one, and it is connection to the natural world. Ooh. As the 7th pillar. And all of its spectra, everything from the sun to the rain to water to the soil to the microbes that are within us in our gut that control our health, connection to these ecosystems, the elements of our ecosystem. So that's lifestyle medicine. That's what I practice. In the beginning, we always knew, smoking cigarettes is not good for us. I knew it before I went to medical school. Who doesn't know that if you're an insomniac, it's not good, right?
Right.
Who doesn't know that exercising is healthy, right? Who doesn't know that if you're stressed out, and you're having panic attacks, it's not good. But I credit the American College of Lifestyle Medicine for really forming into a body, gathering all these together, and forming this specialty where these pillars are focused on in a coordinated way. And that's what I do to bring about people's health. And almost always, when a human being applies themselves and optimizes their behavior in these 7 areas, we don't need medicines. We take them off the medicines. Their problems are reversed. They are prevented almost always. So it's very rare that I actually prescribe medications. I'm usually in the business of what's called de-prescribing. If somebody comes to me with hypertension, the medicines, as long as they're, optimizing their habits, the medicines fall away. If they come with diabetes and cholesterol and other problems, the medicines fall away. So I like to say I'm in the business of de-prescribing.
De-prescribing. That's good.
De-prescribing.
I haven't heard that. I'm wondering who the patients are that come to you. Do they know what they're getting when they come to you?
I think so. There's no one who comes to a farm in the middle of a
that's a
Green
good
Valley,
point.
New Jersey by accident. expecting to find a primary care doctor. Because it's not like I have a medical arts building, right? That's in the middle of the hospital, and they looked me up on their Oxford provider list and whatever. They just put a pin in the program. In order to get here and drive down this farm road under the alley of ancient trees, they have to have done some kind of prep work and needed to have pre-selected themselves. Usually, I would say the profile of our patients is about 50% of them are already plant-based
Mhm.
to some degree and are still, most of them are struggling.
Yeah.
They're either whole food plant-based or vegan or, vegetarian, something like that. And I would say about the other 50% are omnivores. Some of them are eating just catastrophically, like it's eating like they're going to the electric chair, I like to say.
Mhm.
But even they know why they're coming. They know that they don't like what they're doing and they want to change. Otherwise, they wouldn't.
Yes. And I'm assuming most of them follow what you're recommending for the most part.
Yes, I would say for the most part.
It's not
So
easy for a lot of people.
no, it's difficult. I think that the way I started off, I've had two lives as a plant-based doctor, primary care doctor. The first one was in my old practice, where I started experimenting with this after the death of my father and after I became aware of the power of plants. And I would spend an hour sitting with people in a room. This is the way my practice collapsed, by the way. And because I would have to talk to them, I was the only one.
Yeah.
And I would have to educate them. And I found out that, I could only do that for so long. And the way our practice works now is I have an entire team of people who do this.
Nice.
We have health coaches and nutritional educators. And I'm like what I like to call I'm the captain of the boat. I'm the ship. I meet with the patients, I diagnose them. My job is to inspire them, to flesh out their reasons why they're doing this, and to lead the charge. And then my team spends most of the time supporting the patients, guiding the patients, working with them so that it's not so difficult, so that they can actually become accomplished in the doing part. Because otherwise, I think for a lot of people, what you said is correct. It's not easy. It's not easy.
So I'm not sure exactly the specifics of the diet that you recommend. Maybe you could talk about that a little bit, but do you find that some patients respond with a minimal amount of change and then other patients require really strict adherence?
So let me get to the first part of your question in a moment, as to what kind of diet we recommend, what kind of diet of whole plant foods we recommend. They're all different kinds of people.
Yeah.
And that's what makes it so magical and exciting for me after practicing for almost 40 years, seeing hundreds of thousands of patients. When someone walks in the door, I don't know. I get a sense about someone's passion, about their drive. How hard are they going to hit the ground running? Are they going to have to be teased along? But you don't know. Sometimes people can have a cancer, which you don't know what, usually you would expect it not to go away. And then all of a sudden, there's no sign of it. You
Wow.
don't know.
Yeah.
Sometimes we have people who were told that the only way they can survive is be on insulin. And their diabetes is so bad. And then all of a sudden, they're not on insulin anymore after
Mm,
20 years,
wow.
within weeks. Sometimes you'll get someone who was told all of her life that she should just have a gastric bypass surgery because she's been on so many diets that she just can't. There's something wrong with her. It's in the genes. And then all of a sudden, she applies herself and she loses 100 pounds in less than a year. So I look for these people. And this is not to say that everyone is a superstar. I can't say that.
Sure.
But my advice to patients is the more you apply yourself, the more you have the opportunity to be the superstar. And there are very few people who optimize themselves and their behaviors who don't get to their goals. Very few that I see. So let me tell you I'll tell you the kinds of diet we promote here. We promote a diet of what I like to call whole plant foods. And we advise people not to eat animal products and oils and processed sugar and salt. And that's what we do. And moreover, we have a predilection here at this practice to focus on greens.
Yeah.
That by perhaps no chance, no circumstance, it's one of our specialties, it's our main specialty here on the farm is greens.
Mm.
We are experts at growing the best greens that there are. The cruciferous leafy greens and all the different various greens. Yeah. So that's what we do.
Beautiful. I ask from a personal perspective. So before we started this program, you wanted to know a little bit about me. I didn't tell you everything. How could I? But I'm going to tell you a little bit more right now. My listeners know this. So I started on a vegetarian path at 15. I became vegan at 30, and I'm now into it 36 years vegan. Do the math. And I've had a variety of different vegan kinds of diets. And for a long time now, it's been primarily whole food, plant-based. I do like to cook and I do like to eat in restaurants. So eating in restaurants is the challenge. And I would eat as healthy as I could, but there was still plenty of oil, sugar, and salt, right? And I've had high cholesterol for a long time. And I just went and had a carotid duplex, and I had some soft plaque. 1 to 49% is what the report says. It doesn't really hone in. And my CT calcium score is 0. So allegedly I have no hard plaque. Anyway, my doctor is recommending a statin, and I'm probably going to start very soon. But when I got that news, it's been about 2.5 weeks now, I went 100%. So I went from exercising 2 to 3 days a week, and now I exercise over an hour every day. And I'm eating 100% SOS-free, whole food, plant-based. I've always been a fan of greens. You may not know this, but in 2006, I had advanced ovarian cancer. I should be dead. I'm not. And that's because, as you mentioned before, I adhered to my goal and did whatever I needed to do that.
What
So
stage
here I
ovarian
am.
cancer did you have, Karen? You
Advanced
had what
ovarian.
stage?
Advanced ovarian. It was 3C.
Stage 3?
3C. 3C. At that time in 2006, it was around a 10 to 20% survival rate. Now it might be a little higher because they extend people's life with maintenance chemo, which is a
Right.
disaster in my opinion. But
But it was known to be in your peritoneum, your peritoneal cavity.
yeah. Anyway, I'm clean now and happy and fit and feeling good, but
Thank
I
God.
have this soft plaque, and I don't want it. And I don't want to be on statins for the rest of my life. So like, I'm committed now or they're going to commit me. But
Well,
what do you say, doctor?
can I challenge you
Yeah, sure.
right here on the podcast?
Challenge me.
I would challenge you to give yourself a year,
Yeah.
or possibly 2 years, 24 months, just to be on the safe side, 24 months, to see if you could reverse it
Right.
without the stagnation.
Oh, not take them at all.
I wouldn't.
Okay.
But you have also never met Ashagawa.
Who's that?
Ashagawa is the lifestyle director here, and she is our head coach.
Uh-huh.
So the question is we know that your condition is potentially reversible.
I like to hear that.
So would you like to give yourself the opportunity to reverse?
Absolutely. That's what I'm doing now.
Okay, so, and the nice thing about you, you're not at a critical juncture, because someone did a coronary calcium scan on you and you have 0. So
My blood pressure is great. I feel great.
That's good. Yeah. And 49% occlusion of the carotid arteries is not, we start to get worried as it nears 70%, 60%, 70%, 49%, as far as, potential strokes. And I'm not saying that I would wish 49% on anyone, but I think that what I would do if you were my patient is the following.
Mm-hmm.
You ready?
Yeah.
I would place you, or I can't place anyone, but I would counsel a person to go on a diet of whole plant foods via the Ethos Dietary Guidelines, which is a vegetable centric. Of the plant-based diets, plant-based whole foods diets, there can be starch centric and they're vegetable centric. Ours is a vegetable centric one, and of the vegetables, the greens have a special place on the list. And I would employ that at a high level. Perhaps even incorporate some kind of fasting regimen. And what I would do is, before all of this starts, I would get a carotid intimal thickness.
Oh.
Because the carotid intimal thickness is a very focused, close up look, not at just the carotid artery. It's looking at the thinnest, tiniest layer of the inner surface of the carotid artery. It's a much more refined test than the carotid ultrasound, which is a more of a gross test. And then I would repeat that yearly. I would repeat it every year. I'd repeat it. I'd get it now as a baseline. I'd repeat it in 1 year. And then I'd repeat it in year 2. And then, if you want, you could repeat your carotid ultrasound in 2 years, but it's a much more nuanced test than the carotid ultrasound is. So that if you see your intimal thickness, that inner lining, if it's shrinking, you're getting better. You absolutely know. If you see that close-up test is thickening, the thickness of that lining is thickening, you know that you're getting worse.
Right. Okay, so is there any downside to taking a statin in the short term?
Yes, plenty. Number one, probably the biggest, the, well, let me not answer your question first. First, I would like to just ask you a question before I answer your question.
Okay, you're good at that.
Yeah. Well,
We had a late start on this recording because you were asking me all the questions.
yeah. Yeah. So, do you mind if I asked you what your total cholesterol, LDL, HDL, and triglycerides are?
Sure. In fact, I just put it all in a spreadsheet today to look at all my last bunch of years, but I just had it yesterday. Yesterday was 233, and that was like the lowest I've had in a long time. So I started this SOS-free extra exercise, 2 tablespoons of flaxseed every day. It went down about 12 points from May. It was 245. I don't know if that's significant, but the last few years it's been 252, 259, 265, 265, 243, 245, and now 233. Okay. So you want to know triglycerides are mine are normally between like 80 and 130, but yesterday they were 215. No. Yeah, 215.
215.
215.
And what were they a few
In
months
May
ago?
it
when you
was
were
128.
240 total
It was
cholesterol, before you
128.
dropped it?
It was
I'm sorry?
128. It was 128 in May.
So they're usually above 100?
Yeah, 124 in January, 86 in a year ago, 85 the year before that. Kind of goes up and down.
Go ahead. HDL and
Um,
LDL.
yeah, HDL is normally in the 70s, and in May it was 65, and yesterday it was 50.
And your LDL?
And my LDL, the winner, is a disaster. It was 154 in May and 140 yesterday. Life is not
Okay.
fair. It's not fair.
So, well, okay. So now that we know this, here's what I would say before answering. I'm still not ready to answer your question. But the thing I would like to tell you is, or the question I would like to put out there is,
Yeah.
how low can your cholesterol go? How low is it possible for it to go?
For me as an individual?
Yeah.
Yeah.
I mean, 30, do you mind if I ask you how old you are?
66.
66. 30 years ago,
Yeah.
when you were in your early 30s,
Yeah, I don't remember.
what was your cholesterol? Do you know?
No,
When you were a young adult, was it ever abnormal that you
I
know of?
I don't remember.
You don't
I
even
wish.
know if it was probably checked at some point.
Probably. I've looked. I haven't found much. Yeah.
If you are like most people, probably it was
Normal. Yeah.
probably, right? I mean,
I would hope so. Yeah, I wasn't worried about it then.
not these days with our food system, with our corrupted food system, but in the old days, I'm in your category. I'm 62 years old. It would have been unusual for a young adult to have an elevated cholesterol in our generation. That's kind of unusual. Usually you see it from middle age on. So I am going to guess that you're probably like the average young adult back then, and you probably had numbers that were within normal limits. So now the question is, would it be possible for you to get back there? Is that possible? Is it possible? And if you say yes, it's possible, well, how would you actually engineer this? How would you do it? That's what I would like to find out. Before starting on drugs.
Mm,
And here's why. There are many different considerations to taking the drugs, but the most concerning one to me is that the cholesterol drug is a permission slip. As my good friend Dr. Furman likes to say, once we go on the drug, it is a permission slip to not change, to not optimize our cholesterol because, you know what? I'm on the drug. And whether you tell yourself this openly or it's subconsciously, it's just there. It prevents us from achieving excellence and optimizing our lifestyle habits because we have this backstop now of a medication that it is very effective. I'm not saying it's not. The statin agent, if you go on the Crestor and the Lipitor, it will do its job. It's going to lower your LDL to below, I'm guessing for you, it's going to be below 70, which is a target. And God knows, nowadays, cardiologists are even trying to push people below 50. But my greatest concern is that it deprives human achievement and it makes us soft. And because we don't have to try anymore. And you have to remember something, that food is food. And as Hippocrates said, it's medicine, right? So if you're not trying your best, because now you know, well, but I have the Lipitor taking care of everything, right? That's my backstop, so I really get a low cholesterol. And but the statin agent or the Lipitor is not helping to address prevention of cancer or prevention of diabetes, which statin agents seem to increase the risk of, right? Because the foods that you are eating that would basically tend to not make your cholesterol LDL optimal, they're going to increase cancer risk. They're going to increase diabetes risk. They're going to increase hypertension risk. They're going to increase overweight risk. They're going to increase all the other things we don't want also. So that's why I like to drill down first. And I would only give this, remember what I told you in the beginning. It's not like I would never give a drug. I will if I have to. I will prescribe the drug if I have to. But I find that in most people who apply themselves and they reach high achievements, it's unnecessary. I'll give you an example. We have a young gentleman in our practice who had crazy cholesterol. He's now 63 years, 64 years old for all of his life. And he was given Lipitor many, many years ago. His cholesterols, his total cholesterols have been known to be well into the 300s.
Wow.
Okay. LDLs, 200. And I give him a gold medal for lifestyle achievement. He has been and really applied himself. He has, going back years, intimal thickness measurements of the carotid artery that have been diagnosed. And they're above normal, above average reading, okay? And after several years of applying himself, and after, first of all, they never got worse. They never got worse. They just stabilized. And for the first time, he did a 2-week water fast. And the intimal thickness was repeated. And for the first time in our knowledge, it dropped.
Wow.
He has never, many doctors have given him prescriptions for the statins. He's never filled them.
Mm.
And we will continue on our way to demonstrate that, the disease in his carotids continues to improve.
Beautiful. I did do a 2-week water only fast in 2000, I think it was, with Dr. Furman.
At True North?
No, with Dr. Furman when he was in New Jersey. That was a long time ago.
That was.
Yeah. So maybe I need to do some fasting too. Is that what you're implying?
No, I think the first thing that comes first is the high application of the food, because I think the fasting could serve as the cherry on top of the nice cream sundae, but I would do it as an addition, an add-on, to get you extra power. But the day-to-day work has to be the food.
I'm just laughing here because as you said, ice cream sundae, I'm hearing the Mr. Softy theme outside. There's an ice cream truck going out and about in my neighborhood. Yeah. And speaking of that, I think one of the big challenges, and I'm seeing it now, and I don't know what you recommend, but doing this lifestyle and being sociable and traveling, I've had no problem as a long-term vegan enjoying many vegan restaurants, and I really try and choose the healthiest choices, big salads and greens and things, but everything in a restaurant has oil, salt, and sugar. What do you say, Doc?
Yes. I think that's why you have 49%.
Yeah.
Flat. Yes. Look, you got good things going for you. You have a high HDL. Why it's high, I'm not exactly sure. It could be because you're eating too much oil and salt. The oil could cause you have the genetic ability to make a lot of HDL. You said it was in the 70s. I don't know why it was 50 all of a sudden, but maybe it was because you improved your diet. But when you're not eating so well, your liver does have the ability to rescue you by making more HDL to clean out your plaque.
Mm-hmm.
Like, I don't have that ability. There is no way. If I started eating cheeseburgers tomorrow, the best I can do, my liver can do is 40s to make my HDL. For you, if you didn't have that, you'd be 70% clogged up.
Wow. Okay.
If you had my HDL, so I think you do have good things within you potentially. Now you just have to take advantage of them. So we talked about this early. I think where Ethos Primary Care excels is it's the support of patients in the community in allowing them, not only allowing them, but inspiring them to get to a high level and have it be joyful, so that it's not drudgery, so that it's not, you're not isolated, because, if you're not enjoying what you're doing, what's the point?
Yeah.
And so that's why I said, I realized early on, I couldn't do this by myself because I have to see patients. It's an entire team that does it. And I think that with the right kind of support, you can do it. I know it because we have patients who do it.
Okay, I love to hear that. And I hope everybody else loves to hear that too. Do you want to go to this doctor? Are you taking new patients?
We do take new patients. And if you want to get a sense, listen, I don't know when this podcast is airing, but if it's airing soon,
yes,
we have an amazing event here where you can really get the sense of what's going on here on the farm and within the practice. It's called Farm Days. It's on September 14th and 15th. We have had Dr. Furman. We have plant-based and vegan notables here every year. We had Peter Singer, the animal ethicist here last year. Cory Booker was here.
Yay.
The Shirzais, Rich Roll. We've had
Mhm.
Dr. Furman and
Yes.
Dr. Esselstyn and Colin Campbell and Jean Bauer and everyone. This year we have Chef AJ
Great.
because she's coming out with her new book. I'm sure you've had her on your
Yeah.
program, yes.
Yes.
And we have Dr. Goldhammer, the
Good.
king of
Mhm.
fasting, because he's come out with his first dedicated fasting book. Can
Ah,
fasting save your life?
okay.
So we have him and a variety of other different programming here. September 14th and 15th. It's amazing. The food is excellent. You'll see hundreds and hundreds of people who are doing this all together at the
Mm.
same time. So I encourage you and your listeners to come. We're only an hour west of Manhattan by car without traffic. Our website, in order to find out about the festival, I'll give you our farm website. It's ethosfarmtohealth.org. And when you go to the homepage, you'll see the festival advertised. If anyone is interested in becoming a patient, we have an amazing introductory package. It's called the New Patient Package. And here's what it consists of. It consists of 5 visits.
Mm.
An initial visit with me, an entire survey where we go over your entire life, every thread of it within an hour. We give you blood tests, a blood lab. You go to LabCorp to look at inflammation levels, risk of getting a heart attack and a stroke and Alzheimer's disease and cancer and all these things, insulin resistance. Then you come back in about a week or so to have your first coaching session with Asha, where you bundle up everything you're doing to heighten your lifestyle adherence. Then you come back to see me a few weeks later, because a lot of these tests have to go out to the Cleveland Clinic lab because they take a few weeks. We go over all of your results and plot a path forward for you. And then you have another coaching visit, a 50-minute coaching visit with Asha to determine how best we can continue on this path and how you can apply yourself. And we even have an hour session with our expert organic movement physical therapist who
Ooh.
analyzes your movement to see how we can keep ourselves independent as we age and not become dependent on caregivers decades from now, to see where your vulnerabilities are in your frame and in your movements, in your balance, in your strength, in your flexibility. It's amazing. So that is our introductory
Wow.
patient package. It's fantastic. Our website is ethosprimarycare.com. You can find out about that.
I will link those two in this podcast page. And we've come to the end of the hour. And I've really enjoyed getting to know you and learning from you, and you're inspiring me personally. I hope other people are inspired as well. Stay tuned. I want to get back to you in a year and let you know how I'm doing.
Oh, I'd be excited for that.
Okay. Well, maybe I'll see you on your farm. Dr. Ronald has a farm.
We love it. Please come to
E-I-E-I-O.
Farm Days. You'll love it.
Yeah.
Yeah.
Okay, great. Okay. Thank you so much again for joining me.
Thank you so much, Karen.
Okay. Take care. Be well.
You too.
Bye. That's my interview, folks, with Dr. Ron Weiss of Ethos Primary Care. Don't you love a medical doctor who wants to motivate you to be your very best physically, your very best in health, and doing it without medication? They're rare. And I was not expecting to get this information from Dr. Weiss today, but I'm so glad I got the opportunity to interview him and speak with him. And I'm hoping that some of this information has been inspiring to you. Maybe not everybody has high cholesterol, but if there's something with your health that isn't considered right or normal, and your doctors might be recommending medication, think about what you can do first on your own. Take control. That's a whole food plant diet, vegetable based, as Dr. Weiss explained. Dr. Furman would call it greens, beans, onions, mushrooms, seeds, and berries. Minimal starched vegetables, more of the non-starchy vegetables. Some calorie restriction, because extra pounds can cause health problems. And I'm going to keep you posted on my progress. I'm really excited about this. I'm into this SOS free thing for about 4 weeks. I've lost 7 pounds. I don't know where they came from, but I'm enjoying it. I'm never hungry. The key is to be prepared, be organized. That's the message all the time. And I have socialized a couple of times and survived. We were just at a restaurant, in fact, in the Hamptons, and I tried to be super nice and polite to the server and said, I'm a problem eater. And she said, what, do you have allergies? And I said, no. I'm a vegan, but I'm also salt, oil, and sugar free. I'm just wondering if I see you have some salads here, if you could serve me one, maybe add a bunch of different things, take off a bunch of different things, no dressing, maybe some lemon on the side or vinegar, and then whatever steamed vegetables you might make available. And I had a very nice dinner. I was very surprised and pleased. It's not the most imaginative, it's not the most creative. At home, I'm sticking with the imaginative, I'm sticking with the creative, and sticking with the rules at the same time. Maybe at some point, restaurants will change. This is a tall order for restaurants. I know I'm not expecting it. But not all of us need to go this far. But if you are in a health crisis or nothing else seems to work, I highly recommend it. I really believe it's going to work, and it's so inspiring to have a medical doctor tell me, don't take the medication, give it a year, do it. And I am. You might be interested in checking out the Farm Days Festival at the Ethos Farm to Health. The link is in this podcast, and it's coming up September 14th to 15th. This is going to be one place where you can socialize and get healthy, delicious food that is not only vegan, not only whole food plant-based, not only vegetable-based, and not high in starch, but SOS-free. I'm thinking about going. Let's all go, okay? You've been listening to It's All About Food. Thank you for joining me. I'm Karen Hartglass, your host. Find me at responsibleeatingandliving.com. Send me comments and questions at info@realmeals.org. You know what to do, everybody. Have a delicious week.